to all joining us today. My name is Adele Kroch and I am from Food Focus. We are excited to partner with one of our long-standing sponsors, the DSA. The DSA has received a lot of positive feedback from the industry on the value of these webinars, so they decided to provide you with more. Today is the second of 10 webinars we are hosting with the DSA this year. I'm excited to start our discussion about a really important topic in the dairy farming environment, lameness in dairy cattle. We all know that lameness in cows can cause problems. It's not just about the cow's comfort, but it also affects how much milk they produce, their overall health and their happiness. But even though we know it's a big deal, there's still a lot we don't understand about why it happens. Today we're going to look into what actually goes on in a cow's hoof when they become lame. We'll talk about the changes that happen inside the hoof and how they lead to lameness. Understanding these changes can help us figure out how to stop lameness from happening in the first place and how to fix it when it does. During this webinar, we'll look at all the different things that can contribute to lameness, like the environment the cows live in and how they're taken care of. By figuring out what causes lameness, we can find better ways to keep our cows healthy and happy. Now, to bring us up to speed, I would like to introduce you to Dr. Mark Chimes. Dr. Mark Chimes qualified as a veterinarian at the Onderstepoort Veterinary Faculty of the University of Pretoria in 1986. After 30 years in private practice, he joined Deltamune Laboratory as the remunerant technical advisor regarding the vaccines and laboratory tests they offered. In 2016, Mark joined the Dairy Standard Agency as a milk parlour auditor to assist farmers to comply with dairy quality and safety standards. He visits 80 to 120 dairy farms a year and as a result has developed an intimate knowledge of the various dairy farm management and production systems. In 2022, Dr. Chimes was appointed as the manager of the Animal Health and Welfare Program of Milk South Africa, where he also acts as a veterinary advisor. And with that, Mark, it gives me pleasure to hand over to you to present to the audience. Thank you so much, Mark.
Thank you for that, Adele, and welcome to everybody. Thank you for joining this webinar. Now, when it comes to lameness in dairy cows, it's essential to understand what causes it. Oops, sorry, let me just get back. Here we are. The lameness is the third most common cause of production and financial losses on a dairy farm. Yet, it doesn't appear that farmers are spending the third most money on controlling lamenesses as they do on issues of fertility and issues with mastitis, which are the two primary causes of production losses. And the main reason is farmers tend to underrate the importance of lameness, and through no fault of their own. It's because a lot of these lamenesses aren't quite visible and can be quite subclinical, and as a result they're easy to miss. Now, I just want to quickly revise what the negative effects on production are with lameness. The main one is that obviously it's a painful condition. So there are, well, cow's hooves are sore, it's going to lie down. And this increases the risk of mastitis. And the reason is when cows leave the dairy parlor, if they lie down too soon after being milked, the sphincter, that's the muscle that closes the teat end, hasn't contracted yet and it's still open. And if they lie down, especially on a dirty surface, they can get dirt getting into the teeth and then into the udder, causing mastitis. So the solution seems to be when cows are finished milking, you have a feed bank where they go and stand and eat, so that by the time they go and lie down, these teat sphincters have closed up. The other thing is also, if a cow is sore, they will lie down at the cost of other activities. So, which means that instead of walking around finding food or drinking water, they would rather lay down. And as a result, their intake of nutrition is less, and they go into a negative energy balance. They start losing weight. And obviously, because they're eating less, they're producing less milk. And the milk production can be as high as 20% in severely affected cows. It also has a major effect on fertility. And the main pathway, and this is oversimplifying it, but the main pathway is that pain causes stress, and the stress causes the release of cortisone, and this affects the hormonal cycles. And as a result, these cows come into heat. They take longer to come into heat, or they might, in severe cases, not come into heat at all. Have an increased incidence of cystic ovaries. Because they don't ovulate as well, they have difficulty falling pregnant. And as a result, you start seeing it in your data, where you start to have this extended period from calving to first service interval, because the cows are not coming on heat, or extended calving to conception interval, because firstly, they're not coming into heat, and then secondly, they're not falling pregnant as easily. And they found that with lame cows, they will take on average almost a month longer to fall pregnant than non-lame cows. And then you have this added problem that the cows are less likely to stand for the bull. Now, on most dairy farms, the farmers will inseminate the cow 2, maybe 3 times. And if she isn't pregnant, they'll then put her with a bull so that the bull can clean up these stragglers at the end. But now you've got a cow that's already not fallen pregnant, she's already behind, and her feet are sore, and she's not allowing the bull to mount her. So your infertility issues just increase. And also, it's been shown that a cow that showed clinical lameness in the first 70 days in milking, it reduces their chances of pregnancy by up to 25%. And the cost I've just mentioned, these are the indirect costs. They are the hidden costs, or what we might call an erosion disease, where it just erodes your profitability, and it's very, very difficult to pinpoint where the problem comes from. You might think it's a primary fertility issue, when in fact it's a lameness issue that's having an effect on your fertility. And then obviously the obvious costs involved with lameness, which are the direct costs, the cost of the drugs and the treatments. When these cows are on antibiotics or on painkillers, there's a milk withdrawal period where that milk has to be discarded, so there's that loss. Cows that are lame produce less milk, and because it tends to be your high producers that are affected more by lameness, your milk is made even worse as a result. And then in severe cases, there's the culling of animals. And you must remember, by the time it gets to the stage where a cow has been culled for lameness, she's already lost weight. So you're getting a decreased quality of carcass. Not only just a cow that weighs less, but is also downgraded in terms of carcass quality. So there's a double whammy in terms of loss there as well. Furthermore, lameness also has welfare implications, or environmental implications, mainly due to the footpaths and the disinfectants that are used to treat hooves in footpaths. 90% of that ends up in the slurry pit and then gets sprayed out onto the pastures. And the 2 most common ones being used is formaldehyde and copper sulfate. Now, formaldehyde has been classified as a carcinogen, meaning it can cause cancer if you have chronic exposure to it. Copper sulfate, copper has an antibacterial effect. It kills microorganisms, and therefore if these products end up in the slurry pit, it affects the efficiency of the slurry pit to break down the manure. And then if it's sprayed out onto the pastures, obviously copper can accumulate in the environment, and over a long term you might have a problem with copper. Obviously you have to take into effect the dilution factors, how much of this is actually ending up in the slurry compared to how much water and slurry is going with it. How large an area are you spraying the slurry over? So these problems might not appear in the short term, but certainly in the long term, it could affect the microorganisms even within your pasture, and therefore the yield that you get from your pastures as well. Then on top of that, there's the increased use of antibiotics. which could lead to antibiotic resistance developing on your farm, or these antibiotics ending up in the environment as well. Coming back to lameness, and this is why I focus on the hooves in this talk specifically, to remember the 90-90-90 rule. That is that 90% of lamenesses occur in the hoof. 90% of those lamenesses occur in the back feet. 90% of those lamenesses will be on the outside toe of the back foot. And the reason is that the hind feet are used for propulsion, so there's more force on the hind foot. And also when a cow walks, they can see where they put their front feet. They can't really see where they put their back feet. So they'll place their front foot, and when they move forward, the back foot will actually be put down where the front foot was. So the front feet will lead and the back feet will just follow. Now, the obvious deduction that you will tend to make is to, when a cow comes in lame, is let's go straight to the hind feet, check the outside toes. You find, oh yeah, the left hind toe, she's sore. I press on it, so that's the lameness. Be very, very careful of this. The problem might actually be in the right hind foot. But because the right hind foot was painful, she was putting more weight on the left hind foot, and now the left hind foot's got a painful lesion as well. And the joints and the feet. Don't just assume that because you found the lameness that is the only problem there might be. Now, I put down here lameness categories. It's rather a grouping as such. I hate to just categorize things because people then tend to think there are clear borders between these things. They don't, they overlap. Basically, you can group it into three, the causes of lameness into three groups. First of all, hoof lesions, and we'll get to these a little later so that it makes more sense, such as solar ulcers, white line disease, abscesses, thin soles, and injury or penetrating wounds. On the skin lesions, where we're talking things like digital dermatitis, interdigital dermatitis, interdigital growths, foot rot, hairy warts, phlegm on, and all those kind of things that might come up, which affect the skin primarily. And then you have your non-foot lamenesses, and that's injuries above the hoof. Generally, it's an injury either to the muscle or the bone or a joint, or a fracture in severe cases. And obviously some viral diseases can cause lameness as well, like 3-day stiff sickness just as an example. If you look at these categories, and this is how you can try and pinpoint where your lameness. I'm generalizing here, but it's a pretty good guideline to start with. If it's a hoof lesion, just remember the cow carries all its weight on those 4 small hooves. So about 500 kilograms of cow in some cases being shared by 4 hooves. That's 125 kilograms per hoof. That's about 60 kilograms plus minus per toe, which is quite a considerable amount of strain. So hoof lesions tend to be pressure lesions, and the pressure is caused by various environmental surfaces, which is the main cause. So if you have a hoof lesion, look at your surfaces. If it's a skin lesion, it's invariably because of poor hygiene. There's either excess of moisture, keeps the skin wet all the time, or there's a lot of mud, or a combination of the two. And eventually they end up with inflammation of the skin, and then you get all these other lesions forming. If it's a non-foot lesion above the hoof, it's always an injury. And if that's the case, you need to look at your handling facilities or the way that the staff are handling the animals. They might be causing them to run or take short turns and then injure themselves that way. And I'm just going to quickly run through some of the common you find in the hoof, so that when I talk about it later on in the talk, that you've got an idea of what I'm referring to. This is a digital dermatitis. It's basically infection or inflammation of the skin above the hoof or between the toes. So here on the right, you had an infection getting into the skin, and now it's formed a lot of proud flesh, and you've got this huge lesion forming there. Dermatitis, if it's still in the early-ish stages, you might only see red skin, such as here, or you can see additional tissue being formed, and you end up with interdigital growths. Titus includes things like foot rot. A common lesion that is found when the hooves are being trimmed is sole hemorrhage. And this happens when the production of this hoof sole, the horn layer, the area that produces is called the corium, and if that gets damaged, you get some hemorrhaging or some bleeding there, and it sits there. And if it's mild and you trim the hoof coloration, if it is left unchecked, then eventually the corium is damaged even more, and it damages the sole, the growth of the sole even more, and then eventually you'll end up with a deficit in the hoof sole, and which leads to a form ulcer. And we'll get to the physiology of that in a little later. Just some more photos to show you a bit more circumscribed areas, some bruising there. So there's a bleeding in the hoof side to form an ulcer in the middle there. So in other words, if the hoof formation, when it grows out, and that will lead to injury. This is just to show a more diffused hemorrhaging within the foot where the whole area is affected. Just out of interest, you'll notice this line. See it more pronounced here. We'll get to it a bit later. That's called the normally looks like. And then ulcers, you can get ulcers. They tend to be to be honest, when a cow gets to the stage where there's sprout flesh forming, you're probably looking at a cull already. The permanent damage corium that grows the hoof is so severe that it's unlikely, unlikely that it will recover completely. And then furthermore, you'll notice, and this is a toe ulcer. So there's the ulcer in the toe, and that's what it looks like before they opened it. And you'll notice ulcers occur mainly in the toe or in the heel. And we'll get to that in a moment as well. The white line that I spoke to you about earlier, this is the white line disease, or tears in the white line. It is this part here. It's basically where the sole of the hoof attaches to the wall of the hoof. See it quite clearly. You've got the wall of the hoof, which is this dark brown, and the sole of the hoof, which happens to be whiter, a lighter color. And where they join, there's quite a strong bond, but it is unfortunately weaker than the actual hoof itself. And obviously, if this tears and disease, bacteria get in there, then it can lead to an abscess as well. And these tears happen mainly when the animal is bearing weight on the foot and they're turning at the same time, especially if they're coming out of a crush and they have to make a nice soles. The causes are uncertain, but it seems to be due to abrasive surfaces. And it's normally cows that have to walk long distances on walkways to get to the parlor, or where they're kept on very rough cement that works like sandpaper. It's very abrasive. It literally just wears away the sole, and it becomes thin, and then it becomes flexible, and you can actually diagnose it by pressing it with your finger, and if it flexes, then you know that they've got a thin sole. Vertical cracks in the hoof. This is where the cracks start at the top and run down the length of the hoof. The causes aren't clear, but it seems to be primarily a nutritional thing. Supplementing them with biotin certainly seems to help to harden the hoof wall. There are other nutrition supplements that can be given, like your sulfur amino acids, specifically methionine and cysteine. Fatty acids such as linoleic and arachidonic acid, calcium, zinc, and selenium, your vitamins all play a role as well. So speak to your nutritionist and make sure that your diet is balanced, and if you've got hoof problems, let them focus specifically on supplements for the hoof. Now, to get to the anatomy, I couldn't unfortunately find a picture which depicted the human hand next to the cow. So I got this picture instead. This is the foot of a dog, and it's the left foot. So that would be the thumb, and this is the pinky, all right? So if you look at the color here, this is the middle finger, and that's the ring finger. So in the cow, this is what they're walking on. They're walking on their middle finger and on their ring finger, and the hoof is just developed and grown around the last digit of the finger. So when we look at the pictures here, it's the last digit of your finger, the second, and well, 1, 2 is how they would be numbered. So if you cut a cow's hoof through the length, this is what you will see. Now, first of all, number 1 here, that is the hoof wall. And number 2 is the hoof sole. And then these two connect here. Unfortunately, they put the 3 right over that part, but that is where the hoof sole connects to the hoof wall, and that is called the white line. As I said, it's a very strong bond, but it is slightly weaker than the actual hoof itself. Then within the hoof, you've got this bone here. This is the last digit, pedal bone. And that's the other bone in your finger, and then there's another one up here. So that'll be 1, 2, 3 bones in your finger, which is the same as in the hoof. And to attach this bone to the side of the hoof itself, we have these things, number 5, which are strong collagen attachments, which are called the lamina, which place there. Then underneath here, number 9, is a fatty layer called the digital cushion, and this acts to spread the weight evenly when the hoof bears weight. It's not so much a shock absorber as a means of dissipating the weight so that it spreads evenly across the undersurface of the hoof, and it's to protect this layer here, the 6, the corium, from pressure from the bone. And the corium here, this is where the hoof is formed for the sole. So the hoof will grow out from there to here. The corium is only about 1 or 2 millimeters thick, so it's a very thin layer. Even this fatty cushion that's here is only about 5 or 6 millimeters thick. So there's not a lot of room for error here. And then another thing to also pay attention to is that number 8 here, this is the deep digital flex, the tendon. This is the one, if the cow pulls it, it'll bend her toe. And the reason it's important is here where it attaches to the bone. The pedal bone has made a little bump so that there's a better attachment for this ligament. And that bump can sometimes put pressure in this area as well. The other thing is also that the hoof wall grows from up here at number 7. That is the coronary band, which runs right around the hoof. So the hoof wall will grow from there all the way downwards to here. And the hoof sole will grow from here downwards in this direction. So it's almost 2 separate parts that's then attached at the white line. So just to recap again, here you have your coronary band. This is where the new formed, and it runs right around the foot, and it runs all the way down. And then the pink there, which is the corium of the hoof sole. There's the hoof sole, and where it connects is the white line. And the hoof wall grows at the rate of about 5 to 6 millimeters a month. And when you trim the hoof, you will trim it from the coronary band to the tip of the toe. It will be just over 8 centimeters is considered the normal length. Now, if you divide 5 to 6 millimeters a month into 8 centimeters, then you end up with about 10 to 16 months worth of growth. So any damage that happens here will take up to 16 months before it's completely grown out. Once again, just to recap, here's your coronary band, right around the hoof sole, which grows at the hoof sole, and where the wall and sole connect, that is called the white line. Now remember, this is all round, and then this is all the hoof sole, and then this will be the white line, will actually run right around the foot. So if they're bearing weight and they turn, that's when these white line tears happen. Now, the horizontal cracks is caused by an inflamed or infected or damaged coronary band. And what happens is, and the nutritional deficiencies are the most common, and of these nutritional deficiencies, pregnancy is probably the most common one of all, whether it comes to or minerals, and then you get hoof being formed and in the coronary band that is weaker than the normal hoof. And as it grows out, when it roughly rear in the middle somewhere, the pressure on the toe causes the hoof to flex in these weakened areas and eventually. And in this case, the fact that these cracks are in all the feet here, and I'm sure that you examine the back feet, you'll see it there as well, indicates that there was a severe nutritional event about probably 5 or 6 months ago. Most likely pregnancy that led to this, weakened hooves, hoof wall spot, and through all that movement within the hoof, eventually it cracks. And obviously if infection gets in there, then you can end up with abscesses as well. And it can take months to grow. I've said up to 4 months, it's even longer. Because the new hoof literally has to grow all the way down until eventually these cracks fall off it. The same goes with, as I explained, if a cow is carrying weight and they turn, the shearing forces can pull the hoof wall away from the hoof sole, and you end up with these white line fissures or white line cracks. And once again, if infection gets in, it can lead to abscesses in that area as well. Then furthermore, to attach, as I mentioned, those strong collagen fibers that attaches the hoof wall itself. Unfortunately, I couldn't find a decent picture of a cow's hoof, so I've put one in of a horse's hoof, because the horse's hoof actually shows it much better than the cow. These collagen fibers are arranged in little fins, you want to call it that. And it's a similar, if you interlink your fingers of your two hands, forms an strong bond. So if you look at this picture here, here's the hoof wall, got these little fins that stick in that way, and in that side you've got the corium and the coffin bone or the pedal bone with little fins that stick in this way, and then those form the lamina. This is where the term laminitis comes from. If these things become inflamed, then it weakens those collagen bonds, and that's when you end up with laminitis, which is obviously quite a very severely painful condition. Now, the digital cushion is quite important. This is this layer of fat between the hoof sole and the pedal bone. So there's the last digit, the pedal bone, and there's number 2 and number 3 there. And this picture is just to show that this fat layer extends over most of the part of the hoof. And cow starts to lose weight, then this fat pad becomes thinner as well, and then you end up with the bone putting the pressure on the corium. Sole is being formed, and especially here at the back, as I mentioned, you've got this flexor tuberosity here, where the flexor tendon attaches, and that is covered by the fat. And if that fat layer becomes thin, you get more pressure on the corium. The corium doesn't produce good quality hoof wall, and then once that grows out, you've got a weaker hoof, or in severe cases, if the corium had died off, you end up with a deficit called hoof. Just a further picture to show the extent of these digital cushions and how important they are in terms of spread. In this picture here on the right-hand side, they're trying to show chronic damage to it. So you get a lot of fibrous tissue or scar tissue being formed, and therefore there's less fat. And as a result, there is less spread of the weight whenever the hoof is bearing weight. The healthy digital cushion. So once again, on my drawing here, you've got your digital cushions primarily towards the heel here. There is your flexor tuberosities, which I've drawn in black there to show where the pressure is, and that's why you tend to get lesions in the heel, because of the tibial tuberosity. And then obviously the toe end is on this side here. And then I've drawn the white line, which basically goes right around the hoof sole, and the hoof wall connects, so that you know how this works. So if you have pressure being put onto the corium, it leads to bleeding and ultimate corium, and the corium can't form new hoof, or if it does form hoof that's substandard, it's weakened, and it's going to lead, once that injured part of the hoof has grown out, and this can take weeks before that injured part reaches the outside where you can actually see the lesion, and then by then it's already way too late. And that's why you need to catch lameness early. If they've got bruising and you don't stop it, it will lead to death of that area of the corium and ulcer. and it's a vicious cycle. And once they get to that part, once that amount of damage has happened, you get scar tissue forming, and the scar tissue prevents the corium now from producing normal healthy hoof, and these cows have this propensity to recur with coming more and more lamenesses later on in life. And that's why it's so important to catch them at the first signs of lameness to prevent this downward spiral. Now, a major cause of lameness is actually pregnancy. And this tends to be only picked up several weeks to months after calving. Once again, because the damage happens at pregnancy, but it's inside the hoof, that part of the hoof still has to grow out to a stage where you can notice the problem or where it starts causing problems. And the reason for this is when the cow is pregnant, just before calving, the body secretes hormones that loosens the collagen within the body, within the pelvis, so that the ligaments in the pelvis can stretch, so that the pelvic bones can move during birth to allow the calf to pass through. I mean, if you look at the size of a calf, and you look at the cow pelvis, you have to wonder how they managed to get them out. And this is nature's part of doing it. The problem is, it's not just the ligaments in the pelvis that's affected. It affects all ligaments throughout the body, including the collagen fibers that I mentioned earlier that hold the bone of the pedal bone attached to the hoof wall. If that happens, it makes it more likely that these ligaments can either tear or they stretch, and that causes the pedal bone to rotate, or starts putting pressure on the corium of the sole, and it can then lead to either forming in the toe or in the heel. Now, heifers that go lame in their first lactation are 3 times more likely to develop lameness in their second lactation. So it's very important to look at your pregnant cows, and especially their nutrition around that time of calving, not just for the sake of milk production and for rearing the calf, but also keeping the hoof. Find that your lamenesses tend to peak at about 3-4 months after pregnancy. And to illustrate this, what we've got here, if those ligaments here that attaches the pedal bone to the hoof wall, if they stretch, the pedal bone will rotate, and then this toe part starts putting pressure on the sole here. The corium dies off and eventually end up with a toe ulcer. Similarly, if it rotates the other way, you've got this flexor tuberosity, which puts pressure on the digital cushion. And if this cow has been losing weight, because remember, now you've got a calf drinking on her and she's in high milk production, she starts losing weight, this digital cushion loses fat and becomes thinner, and it gives less protection from that flexor tuberosity, and you have even more pressure on the heel, and the next thing you know, you've got a heel ulcer. So you can see why this is a vicious cycle kind of disease. So just to recap, so that you know, this is what a heel ulcer looks like, and that is what a toe ulcer looks like. And this is why most of these ulcers occur in the heel or toe. Now, when it comes to figuring out what your causes of your lameness, primary causes of lameness on your farm is, you need to take into account the system that you use for farming. Obviously, if you're using an open camps TMR system, they're open to the elements. So if there's been a lot of rain, you will tend to get a lot of mud. So these animals are standing in wet conditions and are more likely to develop digital dermatitis as a result of the wet conditions. Based, then obviously these cows have to walk long distances. You have to look at your walkways and the amount of time that they spend standing to be milked, or before they get sent back to the pasture. For instance, and if you've got a TMR system where it's under roof in barns, these animals are kept on cement surfaces, and obviously hygiene sometimes be a problem. So you're looking at hygiene issues, which will lead to skin lesions, or pressure issues that will lead to sole damages. Now, hard and abrasive surfaces cause the most bovine lamenesses. So what is the ideal surface? So no surprises there. Obviously, the cows evolved with grasslands, so grass and sand are the optimal surfaces for cows to walk on. Rubber is a good surface because it absorbs a lot of the impact when they walk and stand, but cows are not very confident on rubber due to its slippery nature. Gravel walkways, it's the most common material used for the walkways, especially for cows on pasture. Obviously, the surface needs to be smooth and level of large stones and rocks. And also, it's essential that it is slanted so that water doesn't accumulate on the walkway, because obviously you'll get mud forming, and it needs to be kept clean. And careful of tractors driving up and down these roadways while the cows are being taken to the parlor or back to the pastures, because that will force the cows off the road into the furrows on the side, and that's where all your stones and mud tends to be. And if it's constantly happening, you could be causing damage to the cow's feet there as well. Tar, by far the worst surface because of its abrasive action. It's like sandpaper, it just wears the hoof down, so try and keep them off tar as much as possible. Concrete is the most commonly used material because of its long-term durability and it's so easy to clean it. But you must remember that concrete is used for the convenience of the farmer and not for the convenience of the cow. It's actually a terrible surface. It's very hard. It's quite abrasive. It's only slightly better than tar, but it is what it is, and it's there for a reason. And so you just need to be aware of it and mitigate the amount of time that they spend on the cement and not chase them around too much so that they make sharp turns and have shearing forces on the hooves as such. And it's not just the surface that affects it, it's the amount of time that they spend standing as well. Cows will not lie down in wet and dirty conditions if they are given the choice. We do see them lying in mud, and then they have no other choice. Cows are highly motivated to lie down, and eventually if there's no area to lie down, then they will lie down in the mud. And it's a very, very important aspect of cow welfare and also of their nutrition. They need to lie down to chew the cud. The only time a cow should be standing is when it's either walking to a parlor, eating and drinking, or being milked. The only time cows are supposed to stand. So you need to make sure that they don't stand waiting too long to be milked, for instance. So if they're standing long periods of time before being milked, then you need to perhaps look at reducing the size of the groups if they're being chased into the towards the parlor, so that they don't have to stand waiting for such long periods. And cows will show rebound behavior. So if they haven't had enough time to lie down, they will sacrifice other activities such as eating and drinking to lie down. So take cognizance of that, especially if for when they have to stand waiting to be inseminated or waiting for the veterinary investigations, etc. You need to take these things into account as well. And obviously, it's not just how long do they stand, but on what kind of surface are they standing. On this photo on the left here, this is poor drainage. So in your design, you need to try and prevent this sort of thing where water can accumulate in muddy parts, because these cows have to move through this area to get to the constantly getting their feet wet. A common problem is ball valves that leak, and then these cribs that overflow, and you have these muddy areas all around the cribs. Very common problem. This is just a poor design, just to show how bad situations can be. You constantly have cows coming in here twice a day, urinating and defecating, and it just makes matters worse. That is the same place here from the other side, and just to show you, these are the handling facilities. Your chances of injuring your cattle by handling them increases actually with systems like this. But that is actually the dairy parlor at the top there. Once again, a leaky water trough and poor necessarily at the feed bunk, and these animals have to walk through that to get to the water and the feed, and they're constantly getting their feet wet and dirty. Obviously, here, from a dairy parlor, you can see with these rocks, it's a disaster waiting to happen. So how do you detect lameness? Now, farmers are reported to underestimate the prevalence of lameness in their herds, and it's through no fault of their own. It's difficult to pick up a cow that's only mildly lame. There's a lack of training, a lack of understanding, and perhaps also a lack of appreciating the effect that lameness has on your profitability. Experience, you need to train. That's the only way to do it. It's not that difficult. If you do it often enough, you'll become quite adept at it. And certainly worth training your staff, especially the person that goes to fetch the cows, pastures or to the barn. If they know what they're supposed to be looking for, you would be amazed at how quickly they can pick these animals up. And just remember that cows are stoic animals because they're a predator species. In other words, predators will eat them, hide any weaknesses so that they don't get singled out. So if you're standing next to the walkway and they're they might actually hide lamenesses, and that's why it's important that it's the guy that's walking them back to the pasture. These cows are in a relaxed mood, and they'll just pick up these lamenesses much easier. The best way to pick up lameness is still locomotion scoring. The only problem I have is that they want to once again categorize it from a level 0 to a level 5, where a level 0 or 1 is a healthy, normal cow, and a level 5 is a severely lame cow. I can't see the point of that. You want to diagnose, are they lame or are they not, period. So is it a healthy cow or a lame cow? Even when it's next to each other and they had to score the same videos of lame cows, 43% of the time they couldn't agree on the level of lameness, but they could at least agree whether the cow was lame or not lame. So just focus on that part. And then if the cow's lame, treat them, and treat them aggressively, regardless of the level of lameness. Because as I said before, once you start having hemorrhaging, if you don't treat that, it leads to death of the corium, and then it leads to ulceration. Whole region already with those cows. And that's not even taking into account those hidden losses that you suffer in the meantime. So treat all lamenesses aggressively, and that involves trimming the affected hoof, and then put on the non-affected hoof to take the pressure off the affected hoof, and then give them a painkiller. This is the absolute minimum. And obviously rest them. Keep them near to the milking parlor so they don't have to walk as far to be milked. And only give antibiotics if there is a sign of infection. If there's no infection, don't give them antibiotics. It's a total waste and it's unnecessary. And you find the sooner you pick these cases up, the less likely they are to become chronic. You want to pick them up before there's scar tissue formation. And that's why when cows have been lame for 6 weeks or more prior to treatment, their cure rate lower if they've been 2 weeks or less. So in an ideal world, you would lameness score every day, but it's time consuming. If you can, about every 2 weeks or so, have somebody stand next to the walkway as the cows are walking back from the parlor, and let him just see if you can see any lame cows coming past and hopefully identify them. Now, there's some handy information here. Those photos of the hoof lesions I showed you come out of this ICAR Claw Health Atlas. This talk is being recorded, so if you want to go back and listen to it again, you can go to the Dairy Standard website and get it there. And now I'm going to show you a video from the Dairy New Zealand hoof lameness scoring that they've produced. It's a very good video. I'm only going to show you a part of it, but it's worthwhile going back and watching the whole video. This is the link here. Very informative, and I would suggest also that you show this to your staff so that they can understand how to pick up lamenesses. It really is a decent video. Thank you, Adele. I hope you all managed to see the video, but that gives you a basic indication of how to pick up lameness. And if you can show that video to the personnel, or specifically the person that has to go and fetch the cows or take them back, it can go a long way in picking up lamenesses much earlier. So to summarize and in closing, what I want to say is, if you remove all causes of lameness tomorrow from your parlor, you will still see cases of lameness for several months and even up to years to really see a major improvement. And the reason is that any cows that have already got lesions developing at the time you fix all the problems, those lesions still have to grow out of the hoof. So those cows will still show their lamenesses when those lesions get to the surface of the hoof. Secondly, older cows that have had hoof lesions previously might have some scar tissue, which leads to cases will also still tend to recur, regardless of the fact that you've improved matters. So the main thing is to try and determine the major causes of lameness on your farm, and that's why this talk has been about understand how these things develop. You can hopefully figure out yourself why you are having problems. So coming back, skin lesions are generally due to wet, unhygienic conditions. Hoof lesions are generally due to pressure, which is a result of the surfaces they're walking on. And white line tears and injuries above the hoof are normally the way that the animals are being handled, or the handling facilities that causes them to injure themselves. And the way to look at this, if you really want to know if you're making any improvement, is you need to record these lamenesses that you're seeing now. Are they new lamenesses from cows that have never been lame before, or are they recurring lamenesses from cows that have had a history of lameness? If your new cases of lameness is reducing, even though you're still seeing a lot of lamenesses, but you're seeing a lot less new cases of cows with no history of previous injury. If there are less of them, then you know that your mitigating measures that you've applied are starting to show results. And to close off, prevention is always better than cure. Focus on the cause of lameness and not on the treatment. By the time they're coming to be treated, it's actually too late already. Thank you.
Thank you so much, Mark, for that very, very interesting discussion and presentation. The audience, you are welcome now to add any questions if you've got any questions for Mark. And while I wait to see if any questions come in, Mark, I've got one or two questions that I would like to ask you. And the first question is, how important is regular hoof trimming?
It's quite important depending on the surface that you're on. If you live on soft surfaces, then you tend to get hoof overgrowth because the hoof is not being worn down as it should, and you end up with these long toes, and that puts a lot of strain on the joints and the ligaments of the feet, and can lead to problems. Also, with regular hoof trimming and feet inspections, you can get a pretty good idea of what kind of lesion you're dealing with. Is it a hoof lesion? Is it a skin lesion? Is it above the hoof, etc.? And the feet need to be balanced. I would certainly suggest that people go some videos on YouTube about trimming the hooves of cows. Because if you see how they trim the hooves and why they do it, then suddenly a lot of things about lameness also makes a lot more sense. And basically it comes down to, they will always trim the inside toe first, and then you will balance the outside toe depending on the length of the inside toe. So the inside toe will determine the length. And then it makes you understand why the outside toes tend to get more damage as such. But yeah, it's a very important part.
Then I've got another question here for you, Mark. Does lameness affect the quality and quantity of milk?
It certainly affects the quantity. I guess your somatic cell count will go up due to the stresses involved. So you might see that. protein and butter fat will only be affected if it affects their nutritional intake. In other words, cows with sore feet might not want to eat as well, and as a result, it can have an indirect effect on protein and butter fat. Also, as I've mentioned before, after milking, if a cow goes and lies down too soon after milking, before the teat ends have closed up, it's getting into the teat canal and causing mastitis. But the primary direct effect is on volume of milk. The quality of milk is affected indirectly.
Okay. Okay, I see. Then thank you, Niku. I've got your question. The question is, watch out for high energy levels in ration, major causes of laminitis. It seems more like a statement than a question.
Yes, Adele, I didn't actually touch on that when I mentioned laminitis, but yeah, there seems to be a connection between high energy levels that leads to laminitis, and that's why you tend to find laminitis more systems where you have high producing cows on high energy feed. Also, chronic acidosis also leads to a problem there, and the reason is with chronic acidosis you get these releases of what they call vasoactive substances, or that's the theory, that causes the arteries in the hoof to contract. Because they're so small, then you have very poor blood flow to the hoof, and the hoof really requires a healthy blood flow. And that then leads to inflammation, and then inflammation leads to swelling, and the swelling closes off the blood supply even further, and it becomes a really painful condition. But yes, high energy rations are considered to be the cause of laminitis, or the major cause.
Then I've got another comment here, and I'm just going to read the comment as it is. I'm sure it's going to make sense to you, Mark. The comment is, lameness compromises quality of primordial oocytes, oocyte. I don't know.
Oocytes.
Okay, so infertility might be seen after a cow is sound again.
This is the problem with lameness. As I say, it's a silent killer, or not a killer, but it's the silent losses. There's sort of an erosion where your profits and your fertility gets eroded, but it's not obvious as to why the problem is. And that's the same why cows that have calved only show lameness 3-4 months later. So the connection isn't always with that, and definitely lameness causes the oocytes, and they damage to them, or suppresses them, and they don't ovulate, take longer to fall pregnant, or they don't fall pregnant much later, weeks or months later.
Okay, and then another comment. New parlors often don't have backing out rubber mats. The cows twist or on their back hooves.
Yeah, that is probably a big contributor to those white line tears, where you have that weight bearing and twisting, and you have the shearing forces. The problem is with rubber mats, when they back out of these rotary systems, is that they can be slippery, and if the cow slips, then they injure their hips or their joints. So it's a trade-off. If you're not suffering with white line tears, then your system works. If you are suffering a lot of white line tears, then you perhaps need to look at a solution there. But the solutions aren't always easy.
So is it the walking surfaces that causes the effect on the back legs most? So why are the back feet affected more by lameness than the front feet?
It's several factors, mainly because the back feet are used for propulsion. So that's what pushes the cow forward. So there's more force on the back feet. And also, as was mentioned in the video as well, the cow can see where she's placing her front feet. The back feet just follow and has to put in the same position. So the back feet can sometimes end up on a stone or something unintentionally. And find with this propulsion, When a cow turns and puts force to go forward, most of that is on the back foot. And if there's a twisting action at the same time, and you have an abrasive surface that has a lot of grip, then you have this, it literally tears the hoof wall from the hoof sole, and you get these cracks. And then obviously, if dirt gets in, you get infected, and eventually other problems as such. It's the outside toes. Also, the outside toes seem to grow faster. As I mentioned, when they trim the hoof, they will always trim the inside toe first and then trim the outside toe to balance it with the inside toe. So the outside toes always seem to grow a lot faster.
Okay, so on that question, how important is regular hoof trimming then?
Always a question is how often should you do it? You know, some guys get the hoof trimmer in once a year, and other guys have them in every 2 weeks. I would say if a cow is lame or if the toe is getting too long, they need to be trimmed, and you need to look at your farming system and how often, how quickly the problems develop. So in an ideal world, you're probably looking at least every 6 weeks or so, but there's a cost factor involved. And then in addition to that, what the farmers do is they'll only pick out the lame animals and give them to the hoof guy. So it's worth going on a hoof trimming course, and that you can do the basic trimmings yourself. And if there's anything more severe, you can get the farrier in or the hoof trimmer to come and sort out the severe cases.
Okay, Mark, I've got two more questions. The second last one, how long before the wet season do you need to start with feed supplements to strengthen the hooves?
Because the hoof grows so slowly, the effect of nutritional supplements will only be seen months later. So if you're planning to just wait until just before the wet season, now suddenly starting with your foot dips and your nutritional things, it's too late, because those hooves have already grown out substandard or weaker. So ideally, they should be having those supplements. You should speak to your nutritionist, and they should be having those supplements throughout the year, so that you always have strong hooves. But I would say you're looking at several months beforehand already. Don't try and anticipate when the wet season is going to be there with all the lots of mud. We had a case last year where in the Southern Cape we had a lot of rain over a longish period, and the farmers, whole cows left, right, and center because of lameness, because of the wet conditions. But those that have been putting the animals through the foot baths throughout the year seem to have had less problems, because their animals' hooves were stronger before the wet season caught everybody unaware.
Yeah. And then the last question, Mark, when should a farmer seek veterinary assistance for a lame cow?
An open-ended question. I think, first of all, your vet needs to be involved. You need to look at your data, and you need to see if your lamenesses are increasing. You need to find the cause. So I think you need to look at the trends, and if your problems are getting more severe, then get the vet involved, regardless of how severe the cows are at that stage. I would say whenever there's an open wound, you would need a therapeutic trim, and whenever they need, look, they all need anti-inflammatories, painkillers. So you should involve your vet on that part, at least to supply with painkillers or to administer it to these animals. And then they would need to advise you on antibiotics. Whenever there is a sign of infection, these animals will need antibiotics, and that's when the vet needs to be involved. And follow the advice from your farrier, your hoofsmith. If they will frequently be able to tell you, look, this one needs serious treatment. You need to get the vet involved.
Okay, wonderful. Mark, that's all the questions. Thank you so much for your time. Thank you so much for sharing your knowledge. And I think the summary for me is prevention is better than cure. And yeah, the observation, making sure that your staff is treated in the right way, to observe if any of the cows are, having lameness and all of that. So thank you very, very much for that. Really appreciate it. And ladies and gentlemen, that brings us to the end. And I'm going to ask you, after the webinar closes, there will be a short survey. And I think it's 5 questions, so it won't take you long. Please be so kind to complete the survey for us. And then the recording will be posted on our website, foodfocus.co.za, and it's on the homepage, and at the top of the page you will see resources. If you hover over the link, it will bring up a tab, webinars, and the recordings of the previous webinars are also listed on this page, and it will also be on the Dairy Standards website, dairystandards.co.za, under the webinars tab. Thank you to all of you that signed in for this webinar, for taking time out of your busy schedule. Please note that the next DSA webinar will be on the 17th of April. As soon as we are aware of what the subject's going to be, we will definitely promote it on our social platforms, and please have a look out for this. So if you are not following us on Twitter, LinkedIn, and on Facebook, please make sure that you do that so that you will be informed of when the topic of the webinar for the 17th of April will be. And then tomorrow you will receive an attendance certificate. Please note that this certificate is automatically generated by the GoToWebinar platform, and please make sure that you download it and save it, because it's not possible for me to reissue this certificate for you. The information you use to register will be used for your certificate, and this cannot be used for CPD points, as the presentation was not allocated any points. So with all of that, have a great day, and for those that's going to have a long weekend, be safe and be blessed. Until the next time. Goodbye, everybody.
Bye, Adele. Bye, everybody. Thank you for tuning in.